Mr. President, Assalamu alaikum. It is my great privilege and honor to make my first international speech as a new Minister of Health of Pakistan through this podium addressing this World Health Assembly. I stand here today with an immense humility and a great sense of responsibility and commitment towards improving the health conditions for the people of my country and make a world a safer place for everybody. Prime Minister Imran Khan also stood here at the same podium in 2007 to receive a gold medal for his phenomenal leadership in building a first state-of-the-art cancer hospital in Pakistan. Mr. President, having spent 15 years myself in WHO and now taking over as a Minister of Health 3 weeks ago, I have been actively reviewing the health situation in my country and setting my priorities. In this regard, let me first announce a new mission for the Ministry of Health in Pakistan, which you will find familiar. So the mission is promote health, keep Pakistan and the world safe, and serve the vulnerable. With this mission and the vision of our Prime Minister to establish Pakistan as a welfare state, my job is to steadily advance Pakistan towards universal health coverage, which is also a linchpin of GPW 13 and an important target of 2030 Sustainable Development Agenda. Health transformation in Pakistan will be guided by the universal health coverage vision. Mr. President, we are conscious of the fact, and as Richard Harden said yesterday, that there is a lot to cover between the rhetoric and the reality of the universal health coverage. Let me share briefly how we are bracing ourselves towards this vision of universal health coverage. Firstly, we are in the process of developing a national UHC benefit package, that is National Package of Essential Health Services and Intersectoral Interventions. We are doing this as a first pilot country in close collaboration with Disease Control Priorities, DCP3. Soon, we will be having a package of 5 kinds of services: promotive, preventive, curative, rehabilitative, and palliative. Services broken down by level of healthcare delivery, and that is community level, primary healthcare level, first level hospitals, tertiary level hospitals, and population level. This is where the importance of primary healthcare becomes evident, as evidence shows that around 80% of the health services can be delivered at the primary healthcare level. Hence, we are launching a major initiative on measuring and improving primary health care in Pakistan following the true spirit of the Astana Declaration. Secondly, we are going to provide universal health insurance in Pakistan, starting with the 10 million poor and vulnerable families. The state is paying and will be paying a substantial premium for secondary inpatient treatment of the poor family members of the prescribed list of diseases and procedures. Until now, we have initiated health insurance in 62 districts, and the program is fast evolving to cover all districts in the country by end 2020. A very important feature of this program is strategic purchasing of health services from the private health sector, which is the best way to engage private health sector without compromising on the need to effectively regulate it where it needs to be regulated. Mr. President, with the framework of universal health coverage, our priorities are clear, and they are as follows. 1, making Pakistan polio-free as soon as possible and effectively addressing the burden of some communicable diseases for which we are bearing a very high burden. 2, life course approach with intense focus on mother and child care, nutrition, and reproductive health. 3, prevention and control of non-communicable diseases with renewed emphasis on effective tobacco control and other risk factors. And lastly, 4, deepening our resilience to deal with all kinds of health emergencies in Pakistan. Like Kenya, Mr. President, we are also in the process of developing a model healthcare system in Islamabad Capital Territory for universal health coverage, for which we have now a memorandum of understanding signed with World Health Organization under the direct patronage of Dr. Tedros and Dr. Ahmed Al-Mandari, who is the Regional Director of Eastern Mediterranean Regional Office. By establishing public sector investment in health as a priority in macroeconomic policy, by fully respecting federal and provincial mandates in health, by strengthening essential public health functions in the country, and by focusing on primary health care as a foundation of universal health coverage, with enhanced domestic resource mobilization and with the continued cooperation of development partners, we believe we will be on course to realize people's rights to health in not a distant future. I thank you very much, Mr.